Earlier in the year, I was diagnosed with a urologic problem, and I saw Dr. John Francis. He is a urologist here at Columbus Regional Health. And in the course of my evaluation, it was found that I required surgery.
So Dr. Sonderman initially came to our clinic with an elevated PSA, or prostate-specific antigen blood test. His number was high, but it wasn't significantly elevated, so we decided to do a more thorough workup with a genetic blood test, as well as an MRI of the pelvis. And that sampling found that Dr. Sonderman had high-risk prostate cancer, one that should certainly be treated for patients of his age. One of the challenges to managing prostate cancer is that there is more than one way to treat the disease. After talking with Dr. Sonderman, taking into account his age, symptoms, and preferences, we elected for a surgical removal of the prostate. The gold standard of surgical management for prostate cancer is a minimally invasive laparoscopic robotic approach, and we've recently upgraded our robotic platform to the Davinci Xi. And the Davinci Xi has numerous improvements on our previous models. We're able to have greater range of motion in our arms. We're also able to minimize blood loss. And at the end of the day, it's resulting in better patient outcomes, quicker recovery from surgery, and less side effects from the surgical management of prostate cancer.
Prostatectomies have been done at our organization for many years. However, prior to the development of the robotic surgery system, those were done in what's called an open method, an open prostatectomy. And many of those, were done here. However, the robotic system does have some advantages, in doing that surgery. Dr. Francis had experience in his residency training with that, and Dr. Stonehill as well, in his practice experience. Both of them were experienced, with that robotic system, and so I felt very confident, in their ability to take care of my problem.
Dr. Sonderman's case, from a surgical perspective, posed several unique challenges, and it required a multidisciplinary team approach to surgically manage his disease.
My experience was wonderful. From my whole time period of my preoperative workup, dealing with Dr. Francis in their office, the staff in the office, my preoperative care here at Columbus Regional Health, to my postoperative care, afterwards. And so I think I had a very rapid recovery and really very minimal pain, which is always very important to patients. So I couldn't be more pleased in that regard. I felt very confident with Columbus Regional Health for my care because of the reputation and our outcomes here at Columbus Regional Health, both from a patient experience perspective and the quality outcomes that we have. And my care team of surgeons I felt very good with their experience, their training, and their demonstrated outcomes.
The Davinci robot has been great for our practice and for our community. Patients are now able to get the best quality care, and they're able to get it close to home.